welcome back to the Curious Neuron podcast. My name is Cindy Hovington and I am your host. Today we are saying welcome back to Jodi and welcome to Chelsea. We're going to talk about the parental brain again, which we did with Jodi a little while back, and maternal brain. And we're going to come back to all of this while discussing Chelsea's new book. Welcome.
Thank you for having me.
Hi, thanks for joining me. I love this conversation because I just think we need to have this a lot more in our society. I will be, all the notes and everything we talk about will be in the show notes, but Mother Brain, Chelsea, is your new book. And I wanted to have the discussion about the postpartum period more specifically, because it is something that there's a lot of research on, but also a place that we need a lot more research on. How about we begin our conversation with just understanding changes that happen to the parental brain in the postpartum period?
I think for me, the big message in the science is that this is a real period of transition, that it's really like a developmental stage of life. And there's a lot to learn about the timeline on which these changes unfold. But what we know is that the parental brain is shaped by hormones and by experience. And it's these changes, we talk a lot about hormones during pregnancy and how, major changes in estrogen and progesterone and oxytocin and other things really serve to preserve the pregnancy and to make childbirth and lactation possible. And we talk a lot less about what they mean for the brain, but the science shows us that, is indicating that those same hormones are sort of priming the brain to be ready to receive our babies, who are these really incredibly powerful stimuli for the brain.
I love that you just said that it's preparing us to receive our baby, because I think that I wanted to chat about this with both of you, but like the term mommy brain, or pregnancy brain too. Like I've often had this conversation with expecting moms who just feel like anything that's going wrong whenever you forget or you're not being mindful of something in that moment, that it's that negative connotation around like mommy brain. But what you're saying is that it's there for the needs of our child.
Absolutely. And some of the most powerful conversations I've had with anyone about this topic are with Jodi, who like, I just so value her knowledge in my own process of writing this book. Like, and she was one of the first researchers I really talked in depth about the science. She would say things like, that we have to like be patient with ourselves and that it's a process. And those things sort of feel like, in other contexts, I might have thought that they were like just catchphrases, but for her, she really has like the knowledge to back that up. And it felt really true.
Thanks, Chelsea. But I also want to add specifically with the memory component that, often one thing we do know is if women are brought into the lab to participate, moms in studies, often they do quite well on memory tests. So there's something about the home environment, which we haven't quite sorted out yet in our research. The cognitive load we talk about that can be playing a role in how we feel about how our brain is functioning. So I think, as amazing as the parental and the maternal brain is, there is a shift or a reorganization to probably to give up some capacities a little bit or diminish them. So perhaps that's where we're feeling this memory loss while we're learning all these amazing things, taking care of our child. So there is, this is an idea we still need to, I think, do more research on, but this reorganization or the shift. And I think when we talk about the memory, which we often talk of in terms of mommy brain, which we'll talk about how we can rebrand that. But I think that there is something there that needs to be sorted out, but we also need to remember, and I think this is, Chelsea's book, right? Where we need to realize how amazing our brains are during this time, because we're essentially keeping a human alive.
I love these studies that have come out in the last couple of years, looking at older adults and comparing parents and non-parents. And these are people in their 50s, 60s, 70s, and beyond. And when researchers look at the brains of parents, they find that they are what the researchers themselves call younger looking. And the thinking is that parenthood presents all of the social, emotional, and cognitive challenges that change, for decades, that it presents these new challenges to us that we have to continually adapt to, and that it's possible that that has this kind of neuroprotective effect, which has also been validated in the rodent research too. So I love those studies because they provide such a powerful counterpoint. And Jodi's right, there's like nuances that are yet to be explored there, what the costs are, but the idea that there could be these long-term benefits is really exciting.
I love that part because I know that there are grandparents that listen to this podcast and feel that we need to talk about grandparents a lot more and their role in caregiving. But basically, I know from my own experience, my in-laws and my mom they've told me, like, you kind of get rejuvenated with these grandkids that come into your life, and all of a sudden you have this extra energy that I don't have as a parent sometimes, when they're like running around and playing pretend with the kids, and I'm like, I'm so tired. But they just feel that it's like the second life for them to just like run around and be a parent in a different way. They could still sleep at night, but they get to play with them all day.
Yeah, it's like they get to put to good use all of that work that that turmoil that their brain went through when they were a parent themselves, and now they can like really use those skills and also not have the sleep deprivation that
yes, exactly.
It's a win-win.
Yes, yeah. Exactly. I there was a study that I had looked at a couple of years ago that was really that really marked me, because it talked about how the mother's brain, like you said, it was going through specific changes, but that a father's brain also experienced similar changes if they had the same amount of time or a similar amount of time spent with their child. And that really marked me, and as well as the audience here at Kirsten, because it means that we need to rethink what we're doing in the postpartum phase, right? We often hear about like the mom spending time and then dads having less, parental leave and less time with their child. Mm-hmm. Some struggle to want to do it, but others want to, but they don't get that opportunity. So what should we be seeing in terms of changes given this sort of research?
Oh, so much. And, I'm here in the United States where we don't have paid leave for anyone, let alone for fathers, at least that not federally mandated. And, but yes, I think, I love the research in fathers and other parents that points to this idea that, that experience really matters, that it is time, it is hormones and exposure, but those are true for all parents who are engaged with their children. And fathers also experience, possible shifts in testosterone and changes in their prolactin system and spikes in oxytocin as they interact with their children. And then, if they spend time in direct care with their babies, that baby is also a powerful stimuli for their brains too. And I think these two messages of, that not only have we sort of underestimated this time of life for mothers as this profound stage of development, but we've also really underestimated whose biology can make them into really good caregivers. And that's anyone who's really engaged in it. And so if we take those two things to be true, there's a lot that needs to change, like social policies, leave options for leave, incentives for leave for fathers and other parents. I also think we can talk more about clinical care and what sorts of supports need to be in place, especially, here in the United States, it's a wasteland. We have the 1 6-week appointment. And I know there's work to be done in other countries too on that front. And then I also think really important piece of this is just the conversation that we have with one another about what it means to become a parent and the struggles and challenges along the way, and around fatherhood in particular, just the level of engagement and the possibilities for them to be changed and for other parents to be changed through the time they spend with their children.
I remember about a year ago, I had posted on Instagram asking parents to talk about their postpartum period and what parental leave looked like in their country. And it was interesting because there were 120 people that took the time to fill in this Google form to say that it's not enough. Most countries was not enough. And a lot of the people that there were moms and dads that spoke about this, but the moms spoke about their mental health and having to go back to work so early and not being ready, even if physically you've been told by a doctor you're good for whatever it is that they decide that you're okay for. Mentally, there's such a shift in your life and in hormones and just balancing all this. And a lot of moms said that retrospectively, they feel like they were going through postpartum anxiety or depression and never even took the moment to realize it. So I wonder if are there countries that are doing this the right way? Or because I think about Canada as well, we have obviously we have more months to take off after we have a child, but the care still isn't there. We get our 6-week appointment to be told we're physically fine, but what's missing, right, in the system, and who's doing it right?
Yeah, I mean, I'm in France, right? So we have childcare quite subsidized and available, which is quite lovely. But in terms of the postpartum care, I think that more could be done. But there are countries, of course, where they have individuals come every day, like the Netherlands, for example, or you have options to work less time, breastfeed, take breaks for breastfeeding your child because their daycare will be close and what have you. So I think we still lack comparison between these different systems. But one thing besides this is there still is a narrative that it's mom's job to take care of babies. Yeah. And I think that's where the switch has to be, is changing this narrative around whose role it is to care for baby. And this is the pressure point, I think, for many individuals, regardless of how much support they might have, is this feeling of, I should be doing this, I'm failing, and the feelings of guilt. It's terrible. I mean, I think this perfect mother myth is really, really pervasive, and we see it here. It exists. I think it's in many Western countries in particular. Yeah, for many reasons, but that needs to change.
Yeah, I agree with Jodi entirely. And I would just add that it's like this idea that it's the mother's job, and that she has everything she needs to do it already, right? Yeah. Like it's innate and automatic in her. And so she's good, rather than seeing that like new parents need massive amounts of support, systemic support, individual support, mental health and physical health, and that those things not only benefit the parent, but really benefit society and our economy and the health of our families.
This is why I love talking about the parental brain, because now we're seeing really the proof, right? I mean, we've known this as researchers for years, that there's no instinct, but there's a priming for sure in the birthing parent. But there's lots of species where another parent also is involved. They don't give birth and they can parent just as well. So we know that it's a learning process. And so if we can continue to prove or discuss the science around this, I think that can alleviate a lot of the pressure of this perfect mother myth, and hopefully reshape our narrative around what it is to be a mother, but also a parent in general.
That community aspect to me is really important, because you think of that phrase like it takes a village, right? And I was just listening to a talk this week by Dr. Bruce Perry, who talks about early adverse experiences and how that impacts the child. But he was talking about connectedness and how we need that to protect the brain. And I was thinking about how it used to be. And I think of like the small villages. My husband's Italian, and in Italy, they would talk about, you would give birth and then like everybody would come together in the village and really help you and feed you and help take care of you so the mom could sleep and help take care of, like there was a really big difference. And I'm assuming that would help that postpartum period.
Definitely. I think definitely. I mean, not to diminish, of course, the individuals. There's many individuals that struggle, even though they have lots of support. And True. So, often there's people who are like, why am I feeling like this? Because I have everything I need. And there's lots of different components and risk factors for developing a mental illness around the perinatal period. But definitely there's something to be said, of course, if you have individuals who are there, other parents or what have you, who can help you protect your sleep, get food in you, get some outdoor time. These things are always beneficial. They might not protect you completely from having depression or anxiety in a severe way, but they can help a bit for sure. So, but yeah, we've moved beyond this so much that I think we are siloing like motherhood, and this is a huge problem. So yeah, the community, building a community, it could be virtual, a little bit virtual. I mean, having people in real life is super, but of course there's virtual components that can be beneficial too. And yeah, sharing also, I think sharing our stories. Often we don't talk about the messiness of birth, postpartum, motherhood. Dads don't talk about seeing the baby's heads all squish coming out. These things that can be really terrifying moments when when many of us have gone through all sorts of messy things, but we don't talk about it. So I think sharing our stories is really important as well.
Yeah, I think a lot about like my experience with sort of that hypervigilance turning into anxiety and in the early postpartum period. And I get asked often about like cross-cultural studies and differences of cross cultures and communities, and we really don't have enough research investigating that now. But I mean, we have almost none really. It's very, very little. But I think about, if there was, I was relatively isolated in just like the kind of typical way of, I had some family support around me, but I had like never seen someone go through this postpartum transition up close and really like understood what happens and their psychology, and I do think about all of the neural changes that happened in me that might have led to those feelings of really overwhelming worry. If I had been someone who had sort of a more intergenerational upbringing or watched sisters or cousins go through that and helped to support them and watched other women supporting them, would I have had those same neural changes, but had them experience them differently? Like, would they have not felt so alarming? Would I have had like the knowledge to know this is part of the process and you come out of it on the other side with these new sort of skills? And so I think that all of that is about communal learning and how much we've lost potentially in that. And I think we need to think seriously about how to build it back into the system.
How do we, I guess, as a society, start building that into the system, right? So we're talking about, we started this conversation by talking about some of the positive changes that happen that help us, nurture our child and take care of them. But then, like we're talking about now, sometimes there are shifts that lead to these difficulties and these challenges for us to nurture our child. We know that mental health and if a caregiver has mental health issues at the beginning, this might impact the attachment from what I understand, right? And a parent might not want to experience this and might fear this and avoid some of the signs and symptoms and just not understand them. A lot of the moms I speak to think retrospectively and say, yeah, I'm pretty sure I had that. And then some dads don't even realize they had that because nobody ever told them that they can have these hormonal changes or these mental health issues as well. So where do we begin this conversation?
One point that I make in the book is that I actually think that psychological distress is really an inherent part of this transition to parenthood. Like, I don't actually know anyone who didn't experience any of it, from like whether it was in fertility or fertility challenges or pregnancy or a traumatic childbirth or postpartum, disorders or going back to work and dealing with all of the anxiety that's involved with that. And so I think if we start to sort of see it that way and like prepare people for it with that in mind, rather than this sort of like rosy Hallmark card picture of new parenthood, there's a lot that I think we could do. And it's none of it's really super clear cut. It's about like shifting our systems and our culture. But a couple of things I've been thinking about is one, I don't think we don't do a good job of screening people for risk factors for postpartum mood and anxiety disorders. We screen for when they're in crisis already, but there's no like universal screening tools for the risk factors. And here in the United States, there's been some movement towards getting psychotherapy for people at risk for postpartum mood and anxiety disorders covered by insurance, but there's been no implementation of that program. I think that's one thing we could start the conversation much earlier. My husband went to this program called Boot Camp for New Dads. He really didn't have like a paternal model. And so he did this program that is nationally licensed here in the United States. And it's a program that brings in expectant fathers with brand new fathers. Two fathers come with their babies, and then there's a facilitator. And it's like this time to like see the father interacting with the baby, like recognize that he can do it, ask any questions. There's like a program of things that they cover, including mental health and childbirth and maternal gatekeeping and other things. But they also just like get this time to like talk and ask anything that they might want to ask. And I was thinking the other day about how like there actually isn't a correlation for mothers. And like there's not a similar program here for mothers. There's a lot of programs that are like, pregnancy classes and childbirth classes and infant safety classes, but not this sort of like wide open space to just like come and ask, like, especially to come and ask a brand new parent, like, how has it been for you? That's like sort of open, but also facilitated. Like, I don't know of many programs like that. And I think that could go a long way.
Just also wanted to add, I mean, this is also speaking about experience, right? Like, so maybe if you had grown up with siblings who were 10 years younger, you had some experience. If we encouraged males to participate or play with dolls, maybe this would make a difference, right? But this is all about experience with baby. They're learning. And I think this is really important. I also think, like what Chelsea said, there's a huge emotional change with parenting, which is normal and natural. So it's not all happy times. But of course, if you're feeling like you're unhappy more days than you're happy, then you need to speak to someone or reach out for some support just to check in to see what's going on, because I think it's really valuable to know that many people struggle with a mental illness during this time. It's pretty normal, and there's lots of treatments and options and support available to help feel better. And I mean, I always say Postpartum Support International is a go-to. There's so much information there for moms, dads, all parents. And so that's something to check in if you're curious about where you're at on the mental health scale. Have a look at their website for resources and contact information.
Yep. We're going to add the links to what Chelsea said. That group I think would be important to have on the show notes, as well as what you just mentioned, Jodi, because I think those two links are really valuable for parents. But it's so true that we need to start before. And I was thinking of even my own experience here. We would connect with a clinic and have these like prenatal classes where you learned how to hold your baby, and you learned how to nurse, and you learned how to feed your baby, whatever path you took. But it was those sort of things that we learned versus how to work on ourselves or understanding our mental health, or understanding how perhaps our childhood is going to impact how we look at parenting. And I find that we need a lot more of that, because for me, everything was kind of smooth until there were emotions involved. And then I realized like my past kind of influenced how I dealt with emotions. It never impacted me really as an adult. I mean, in a relationship, only looking back, I was like, oh yeah, I saw the signs were there in terms of knowing how to regulate my emotions. But then everything came out with my children. So there's so much that we do need to learn with regards to that.
Yeah, definitely.
I'm thinking now, like a parent who's listening, and they might be wondering, we haven't really mentioned like what signs and symptoms are. And also something that I often hear about, Jodi, you mentioned the sadness, which I totally agree with, but I think also we don't hear about the anxiety as often, only like retrospectively, or anger. Some moms talk about rage. Is there research around the rage part? Is the first part of my question. And also, what are things that we should be looking for within our environment and the way that we're acting or responding, after having our baby in that postpartum phase?
I mean, I'm going to jump in on the rage point, because we don't actually have, in terms of brain and rage postpartum, we don't have anything that I know of. It's really important to talk about, because it's definitely part of, usually in depression kind of suite of symptoms. And it's very common to feel this rage periodically, but there's feelings of rage. I've talked to moms that are just like from nowhere, they come out. And it's significant. I think sometimes it's actually, I mean, I've had conversations about this with people who really struggle with it, but it's really a normal response to what they're going on in their lives, right? The impossibility of trying to be a perfect mom, the lack of support. I mean, you have every right to be furious about this, for sure. I mean, but then we need to figure out how do we direct that anger in a proper way. How do we change our environment? How do we let, those feelings go, modify things so we feel better? But I think there's a very, very, very valid reason we're feeling these emotions, all of them, the anxiety, depression included, but we just have to sort out how then to manage them, of course. But I think for me, this is maybe my opinion, the rage comes up in response to society. Like, how is it possible that I'm supposed to be happy all the time and do all this stuff and everyone's loving it, parenting, and I'm not? Like, this is I think this is a reasonable response.
Yeah.
So
and even in those moments, I that's why I wanted to bring it up, because a lot of moms will say, like, I just, it comes out of nowhere. And that's the sort of phrase that you hear very often. And I get it. I've experienced it myself too. And it's just, I think the overwhelm of perhaps your day or your month, and it just comes out in the weirdest moments. Like something's missing in the fridge and you slam it and you're done. Or like your child says something or your baby cries, and you go from like nurturing to just really angry, and we don't understand it. But I've looked up some research so many times, and you're right, there's nothing out there. And it's I think that's why sometimes moms don't feel like that's validated. Like, is this normal? And it goes back to Chelsea's point that sometimes you just need to speak to somebody else who's experienced this and say, yeah, I had that and it passed, or I did this to help myself, like to have that connection.
On that point of rage, if you want a really great book about someone's experience with postnatal depression, it's After the Storm by Emma Jane Unsworth. She writes about it, and one of her main symptoms was rage. And I think that book, I absolutely loved the book. I've listened to it twice and I've talked to Emma about it. But it's really important. It's a really important message because she's sharing what she went through. She overcame it. It validates a lot of people's experience if they, look at it. So you feel like more normalized. Yeah. But her experience, I mean, the book's great. It's really, really a wonderful, eye-opening book. So yeah.
I second that. And also I just want to go back to the point of like how much more research we need. We really don't have a lot on maternal mental health or cognitive function beyond like the initial postpartum period. And I think that that's these are questions that kind of desperately need to be answered, especially if you have toddlers or young children, and it's a really like intense sensory experience of just like intense, constant, ceaseless demands. And you live within a system that has allowed you to kind of live in burnout for all of those first years of her life. Like, it makes sense that you would be overwhelmed by those demands sometimes or often. And I think understanding more of that mental health picture in sort of like the early childhood years for mothers is really important, could be very, very important and perhaps moving some of the needle on social policies too.
Yeah.
I just wanted to bring up with regards to anxiety, because we got on the rage topic, but talk about anxiety. Yeah. And a lot of times, I think one thing that we need to talk more about is the obsessive thoughts, which aren't technically defined as anxiety disorder anymore. They're OCD. Ignore that. Before I had kids, a friend of mine told me she had a 2-year-old, and she's like, you will have 1,000 thoughts a day of how your kid will get hurt or die or something you'll do to it or whatever. 1,000. And I was like, oh my gosh, like this is crazy. But I filed that away. And that was really important because I don't think we talk about all these thoughts that fly through our brains. And then for some of us, we grab onto them and then we end up obsessing over them. I'm going to throw baby down the stairs. I'm going to whatever. They're horrible, horrible, horrible thoughts. They're super normal. Over 90% of parents have them. It's really, really, really normal to have these horrific thoughts. The point is, if you start to have them, you need to find a perinatal health trained practitioner to talk about them. It's terrifying to talk about, but it's something you need to talk about, because the trick with those thoughts are, if you don't talk about them, they'll just keep playing their little record. And so I think it's really important to acknowledge, one, it's super normal to have all sorts of crazy thoughts. Two, you will never in these cases hurt your baby. It's really not going to happen. And just seek out some support, because you can recover from this and they can stop. So I think that's really important.
Just talking about it helps. I just posted a podcast episode. It felt weird talking about it for the first time, but after I gave birth to my first child, during that phase, I was obsessed with thinking about the fact that I'm going to die one day. That was my obsession. Obviously with her as well, I was afraid that anybody held her wrong, or is she breathing, and watching over her at night. But for me, it was just this realization or this fear around, like, when I was driving, is something going to happen to me? Am I going to never see her again? What's going to, and that kind of, and it became truly obsessive. and was hard to get out of, but I did eventually. And speaking to people about it that were close to me, or even just crying about it with somebody that I felt safe with, was very helpful in that phase. So I'm really happy that you brought that up.
It's the thing that really made me fall in love with this research the first time, because that was very much my experience as well, worrying about my son's safety, and then feeling like all of those worries were somehow a sign that I was like failing him, and that they had like pushed out that like warmth and certainty that I kind of thought I should be feeling in that time. And learning in particular about the science of maternal anxiety and the maternal brain more generally, and this idea that like our brains are really working to drive our attention towards our children, to motivate us to take care of them, to focus on them, to be vigilant about them, and to like attach meaning to them and all of their cues and everything around their safety, helped me to kind of reframe that and see that kind of obsessiveness to some degree as like productive. And just as Jodi said, like it's very normal. The problem is when you get fixated on those thoughts and you can't let them go. But I do think that giving people the information about what's happening to the brain that make that thing so normal could help people to frame it in a way that is healthy and also manageable, at least some folks. And if it's not, doesn't feel manageable, then of course seek out help. And it's something that you can recover from.
Yeah. I often think it's your brain demanding something. Often our mental health is your brain is demanding something. It's demanding rest, it's demanding something change. And so, I like this, Chelsea, is just if we can acknowledge that there's a physical component, a biological, neurobiological component, it kind of gives us a bit more control. And then we can be like, okay, so I can manage this, or I know that there's something going on there, but then I can hopefully modify it with support or what have you. So I think it's really important.
Not to wait and see either, because I remember when during my it was my second pregnancy, all of a sudden I was just crying every single day, and I didn't realize that I was overworking, and it was sort of like a burnout. But I remember not telling my doctor because I just figured it's hormones. Who cares? It'll pass, right? And not even telling my husband at the beginning because I was attributing it to silly hormones. I'm just crying all the time. And then there was a moment where I just broke down in my doctor's office, and he's like, "What's going on?" I'm like, "I don't know. I just cry all the time." And he set me up with a psychiatrist and said, like, "I just want to make sure that postpartum you'll be okay as well, because you have more chances of postpartum depression if you're experiencing this." And I stopped working. He had told me just stop working. It was a bit much. And I was near the end of my pregnancy, and then everything shifted and changed. And that could be just my experience. It doesn't mean that everybody will have that kind of change. But for me, it was just the fatigue and the stress that was contributing to that. But that's why it's so important to speak to somebody about it and to just put it out there, and not to wait and say, well, they're just hormones, it'll be fine after, because then there could be higher chances of that postpartum phase.
Yeah, definitely.
Yeah. I just realized, I know that some parents have asked me, what is the definition of the postpartum period? How long after we have our child is that period?
Is this a trick question?
Yeah.
Multiple choice, no. All of the above?
Yeah, right. No, the only reason I just realized now, because some moms will ask me, or tell me that their anxiety only came up later, 8 months, 10 months later after. And they ask, like, is this still the postpartum? Is this postpartum anxiety? Is this normal anxiety, or are these feelings depression, postpartum depression? How do we know?
I mean, I can tell you here, I've heard stories where the physician has been like, oh, you're 1 year postpartum, you don't need your medication anymore for your depression. I'm like, what? I mean, I don't know what the proper definition is. Okay, for me, curious. I feel like, I mean, I'm very open to however anybody wants to define it. Really, for me personally, it's not a big deal. I mean, that's it. That's my take.
Yeah. So I have two thoughts on this. One is like it's a word that doesn't need to be defined, except that we constantly are defining it, right? Like we're like, in terms of how we're measuring things, like, okay, maternal mortality, for example, when you start looking at the maternal deaths up to a year, you realize that they're really dramatic, and it has a lot to do with mental health and especially here in the United States. And or if you look at rates of depression, or also you can look at, there was recently a few years ago a study done in the Midwest somewhere, that looked at women who screened negative at their 6-week appointment, who then went on to develop postpartum mood and anxiety disorders. And it was something like 8% of the people who had previously been negative. So it's a pretty significant figure. I think embedded in this question is this idea that it is a distinct period, that rather than a new stage of development that changes us for good, for the rest of our lives. And that's how that is what it is. And so how do we help the research and the conversation catch up to that?
That is such a good answer, because now I think knowing that we could just shift the way that we're thinking about it. And even for myself, I had 3 kids under 4 years. So was I in and out of it? Was I continuously in it? Am I still in and out? I think we don't have to give a definition to that, but you've had a child and now you're in that postpartum phase, and it's that development, that stage of life that you're in now, will change the way. We don't need to have a specific date on that.
Although I'd have to say probably for policies and things like this, they like to have dates and timeframes for postpartum, let's say. But I mean, once you're a parent, you're always a parent. And so this is something, I mean, when I think of the brain, I think it's always going to be changing now that you're a parent, because you have these dependents or this different relationship, right, with your kids, and you have to constantly learn and interact with them as things go. So there's that component there. So I always think, why aren't we appreciating the fact that parenting impacts our health and our brain more? I mean, it's not just like a fun little project we do as neuroscientists to understand this, how the brain changes with parenting. Oh, that's so cool. But now we're actually proving that it's changing forever. So this is a big deal, right? So I think we need to start to appreciate that in terms of science, medicine, and what have you. Yeah,
I agree entirely. And I just this morning actually saw something on social media about how it was talking about the postpartum brain change or changes in the postpartum period. And it said something about the loss of gray matter, and how it takes up to 6 months for that gray matter to be restored. And I was like, that's not quite it, so I do think we have to be kind of like vigilant that the science doesn't get twisted in the way to like fit that narrative that there is a period and then you're back to normal. You don't go back, you go forward into this new role, this new part of your life.
But not to like terrify listeners out there. Of course, you'll have your old life, parts of it or most of it will come back with the complement of sorting out what to do with your kids sometimes. So, I mean, and other things around that. But I always think we don't transform into completely new humans, but it's a different part of us that becomes essentially us. But we still have our other parts that will come back maybe later in the postpartum, however you define that, be developed a bit more. But it is a transition. It's a life change.
Given the research that you've both done and read, what would you like new parents or expecting parents to know that will help them as they move forward in this new phase of their life?
My typical answer to that is really that to remember that experience matters, that in the sense that you're not supposed to know everything once your baby arrives. There is no magical flip of the switch that your maternal instinct clicks on. This is a growing process, and so in that, try to give yourself some grace and some patience to grow and to make mistakes, but also to learn from them and to grow along with your particular baby.
Yeah. And I would also add on the brain note specifically, I mean, this whole mommy brain rebranding bit, perhaps I'm going to throw in here, is that I really want us to think of our brains as mothers in particular as something incredibly amazing. I mean, it goes through a lot of these changes, like Chelsea mentioned, in order for us to learn how to keep baby alive, essentially. Of course, we don't have to be the primary caregiver, but this process has taken place in our brains so we can figure it out. And I think we have to, of course, acknowledge that memory is maybe a thing we struggle with or what have you, but let's not have mommy brain be defined by a deficit, essentially, or something we find as a deficit. Let's have it rebranded to really signify how amazing our brains are during this time. And I think that's really important, not to downplay the role of the brain, essentially, in parenting. And we really have to start to give it the credit it deserves.
Yeah, I agree.
Yeah.
And I love how we've had this conversation today about the maternal brain, but the parental brain as well. And I think we need to continue these conversations around the changes. And like you said, Chelsea, like the experience and how we can shift the narrative in our society.
Definitely. Yeah.
Yeah, I know. I love that. Thank you, both of you, for taking the time to chat with me today. Can you please, Jodi, I know you have a new book out as well. Je pense que c'est en français seulement, oui.
Oui.
Yeah. So is there an English version coming out too? I know there are French listeners and English listeners. Are we
hopefully soonish, but nothing right now, but definitely it's available in French for the francophones out there.
Good. So those of you from Montreal, it's available. And Chelsea, your book Mother Brain is available now for everyone to purchase anywhere. I'm assuming Amazon.
Yep, anywhere. And they can find more info at motherbrainbook.com.
Thank you. And I will put the links to both your books. I will put the links to your podcast as well, Jodi, so that everybody could learn more about the postpartum brain and the maternal brain. Thank you both to both of you.